There's so many factors that go into having a stroke. There are deficits and things that come along with that. The beauty of it is seeing the recovery. I like to watch the glow on the patient's face whenever they can't stand one day and they're walking the next day. When a patient's told they can finally swallow after they hadn't been able to eat days prior.
So it's real important when you notice that your family member has the symptom of a stroke that you bring them immediately. You don't let them just rest and see if it gets better and then bring them.
We're going to be checking vital signs. We're going to be checking pupils, neurologic response, NIH score, all of that very frequently. So as the ICU nurse, it's very important to get to know your patient early so you can detect changes in their status and possible worsening condition.
The most important thing for a stroke patient is being there emotionally for them, whether that's a deficit from a stroke that's caused a cognitive deficit, physical speech, sometimes it's swallowing. There's so many different things that go along with it, and no two strokes are the same. No two patients' journeys are the same. Some patients have underlying medical conditions that makes their stroke journey different. So there's a lot to consider, and I think that being there for the patient emotionally as well as the family, these are life-changing events.
Making sure that the patient feels safe and understands what's going on, because when they come in, there's a lot of things happening all at once.
When a family member thinks that their family member is having a stroke, they should call 911. They should always call 911. They should not put their loved one in a vehicle and drive them here. We want them to call 911 and get to the emergency room as quickly as possible. So after you called 911 and the EMS arrives, they will call and notify us that they are inbound with a patient who has these deficits, and they're calling a neuro alert. So that helps us to be ready for them whenever they get there. Time is of the essence because time is brain.
We can be impacted as nurses watching a patient almost make a full recovery before they even leave the hospital in some cases.
Getting down to that human level, taking yourself out of scrubs, taking yourself out of the medical role and actually seeing them as a human, imagining it as yourself or your husband or your wife, etc. So I do like to let them know, like, hey, you're not alone. This is happening all around you. You are unique. We are here for you, and everyone's needs are different. So whatever you need, please bring it to the table.